I call this health meeting to order at 10:20, and first, Councilor Snell is going to give the invocation for us.
Rise, please. Dear Heavenly Father, Lord, thank you for this beautiful fall day you provided for us. And Lord, be with us as we go through the committee meeting today. Lord, we pray that you'll give us good decisions to make, give us good wisdom, and just be with everybody that's here today. Bless everyone today, Lord. In Jesus' name we pray. Amen.
Amen. Ms. Shelley, would you do the roll call, please?
Yes, ma'am. Janelle Fulbright.
Present.
Dick Lay.
Here.
Bill England.
Here.
Jack Baker.
Here.
Joe Bird. Juliet Coates. Jody Fishinghawk. Meredith Fraley. Here. Don Garvin. Tana Gloria Jordan. Frankie Hargis.
Present.
Chuck Hoskin Jr. Lee Here. Curtis Snell.
Here.
David Thornton.
Here.
David Walkingstick. Kara Cowan Watts. All honey. We do have a quorum.
Okay. Next is the approval of the minutes from October the
Motion to
15th.
be approved.
We have a second.
Second.
That's been approved and second. All in favor, say aye.
Aye.
So we approve the minutes. First, we have reports. Claremore Service Unit, Mr. George Valyers. Come up and report to us. Good morning.
I apologize, my report wasn't in your package. I was kind of out of pocket for a couple of weeks. It's coming around, and then I think Vicki Snell came down last month, and she said that you guys had asked about contract health flow chart. So she sent that to you. As that's going around, I'll highlight we finished up the year a little over $2 million ahead on collections. Our outpatient visits were up. We're just about to make an offer to a third OB doc, a female resident finishing residency. She should be available next July. So things are moving forward. Any questions?
Anyone have any questions for Mr. Valyers? Okay. If no one has any questions, we'll move on to the next order of business. Cherokee Nation Health Services, Ms. Connie Davis.
Good morning.
Good morning.
You had an opportunity to review the Health Committee report. You'll also find at each of your chairs a notebook, as requested last month, to begin to unwind and understand all the joint ventures and businesses that we can find that the health department is involved with. I think that was one of the reasons to set the meeting up at this time and allow some time for questions and answers. And I know that's a lot of documents to review in this time. I've tried to provide a brief summary of each of those organizations in the attachment at your desk as well. And I've also invited a couple of guests who have been here since the inception of some of these programs to help answer questions as well. So how would you like to proceed? Do you want a few minutes to review the documents, or you want me to just keep talking? Keep talking. Okay, the Comprehensive Care Agency is one, and this is kind of an umbrella organization that oversees our PACE program that is also called Cherokee Elder Care. So it's kind of confusing to me that we have 2 or 3 different names for the same entity. It was created by resolution in 2006 to be part of the health department and to provide services. Nobody explains that in the handout, all the doing businesses as. But this is like an on-site adult daycare. It helps patients who are almost nursing home eligible. It keeps them in their home. It provides several therapies, physical therapy, occupational therapy, It's a great organization. I think we have now 122 patients to come in. And that's a point to where you have to consider expansion. We are at capacity there in that building. Thelma Pittman is the Chief Financial Officer for that organization. And if you have specific questions, she's been here since the inception of the program. Yes. The current board members are Janie Dibble, she's the acting chair, or the current chair. Deb Proctor is the vice chair. Elmer Tadpole is secretary. Dr. Montgomery is now the treasurer, and I'm the other member. Now, something I've learned as I reviewed the bylaws is that the council can have 2 representatives as board members on there, ex officios. So if you'd like to take this opportunity to choose 2 board members to attend those meetings, that might be a good time to consider that or act on that.
Madam Chair, because it's not on the agenda, I would just ask that it be placed on next month's agenda as an item.
We may have someone interested or wants to volunteer.
And
we'll do that
just
next month.
For planning purposes, we're trying to schedule that meeting to be the first Monday of the month, I think at 2. So for those who may be interested in attending or in participating in that board.
Madam Chair,
Yes.
I know this is what my agenda item is, the number 2, so I don't know if you want to continue this discussion under that agenda item, or we'll just, forego it later. But I have lots of questions around this information that's been presented to us today. I don't know how you want to proceed.
Well, I don't think it really makes any difference, but she's given us the book, and this is your agenda item. That's true.
If it's okay, I'll proceed at this time. And then
Okay.
If there's any. So, Connie, thank you so much, because this is one of the things I was looking for was a compilation of what has been done today. So, I think the two or three major concerns that I had were, first of all, understanding the structure of the entities and how they overlap or contributed to each other. Because we had for-profit type entities contributing back to PACE, for example, is the way I understood it. But I hadn't had time to do the research. And it looks like you've done that for us here.
I've tried to and try to understand it as much. But I tell you, Sharon Swepson has been an acting board member on both the Comprehensive Care Agency and the Home Health Board, and she can answer a lot of the questions that we have.
So one of the things that might help me better understand is almost have to have a flow chart, I think. It's like we have like the backup information, which we definitely need to detail to refer back to. But I almost need a flow chart, and the flow chart should reflect, how they're structured, who owns what. Like, for example, the for-profit entities at Tahlequah that are feeding the PACE, and I understand by federal law, those entities can't be touched, so that money can't be touched, because the way it's structured today, that has to benefit PACE. And so if we use that money for anything else, we're violating that, we could lose our PACE program, is what I understood. So understanding what that structure is and making sure to answer that question, is that factual, is that true? We need to know that. I don't know if the AG's office may have further information around it, but that's what I wanted to get out on the table last month so that we could have more answers this month, was where are we at?
Okay.
So there's Medicare, Medicaid implications. I understand PACE has its own set of laws. Maybe it's a subset of Medicare, Medicaid, but it has a definitive set of laws that are different, or regulations on how we can operate or spend money. And I wanted to make sure that any of our recent actions hadn't put these programs at jeopardy. And then how we're going to do home health going forward, I think that hasn't been answered. And is it tied? Have we done our research to know, is it tied to any of these other programs? I'm seeing Sharon shaking her head no, so that's comforting. But I think we need to know, too, this was more of like the regulatory impacts. I don't know if there's any changes under the Affordable Care Act. Obviously, Obama won the election. It's not going away probably anytime soon. So I think there's changes coming on Medicare, Medicaid regulations. Will that also impact these recent decisions we've made and the decisions that seem to be coming about these programs? Because I do not want to lose any of these programs. I don't want to affect these staff that are involved. I want to make sure that we make informed decisions. I don't know that we've made informed decisions, and that's what I'm concerned about. So one of the things, I'm going to look through this after the meeting, because we obviously just got it, and see if there's anything I can catch. But if I could have a flow chart of sorts or an org chart that sets all this out, how everything's interconnected, and whether it's regulated then by Medicare, Medicaid, or a subset of regulations, or I think we need to have a quick look too that helps us understand why these other documents are relevant in what context.
Okay.
If that makes any sense at all, because
Well,
this is complicated.
I think I can summarize some of that.
Okay.
They do operate under a Medicare licensure. So
Okay.
that answers that.
For PACE.
PACE, home health, and hospice.
Okay.
They're separate, yes, they're all separate Medicare license. Thanks for the clarification. They're separate entities. And they're operated or governed by a board that's selected by and appointed by the chief and approved by the council. So that's the very short answer.
And there's none of them, and I don't want to put anything at risk, and I don't have time to figure out what Medicare regulations are and these other laws. So, and there's no problem with the way we've structured the boards where a lot of people are on the same boards with their staff. That's all clear. There's no conflicts of interest.
I could not find any because I did
Yeah.
take some time to read particularly the PACE. I do have their guidelines, and I'll be happy to send those electronically if you'd like. I meant to get those copied and do not, but I can share that by email if you'd like.
Yeah, emails, we won't have to pull a tree.
I
It'd be
agree.
better, 'cause
I appreciate
figure
that as well.
They're substantial, but I'm still old school a little bit, so I like to do it. I think that we're definitely on the right track, that I'm seeing this compilation of stuff, because I just understand when I talk to some former staff members that it is all interlayered and we're potentially putting some things at risk. So I want to make sure that some of the recent decisions we've made, or some of the decisions that seem to be pending, are not going to impact those things. Okay, very good.
And we have Liz here, and she's helping us review these documents, and in the AG's office is Odell, and we can look for those specific issues.
Since we're on this, Liz, did you have anything, or Ms. Odell, did you have anything that you wanted to add to the discussion, just so that we have all the facts on the table, or as we get them?
Yeah, any questions like this, we will try to look into. We have looked at the different structures. At this point, they are completely separate. Some of the issue was in what they were named and what all goes together, because the hospice and all those fall under the home health and different. Like she said, there's so many different things.
So on the org chart, you can give us a cheat sheet on all the different names. I think that would be helpful too, as we're referencing documents. So in your findings on the corporations or set up as for-profit entities in partnership, for example, with the Tahlequah City Hospital or any of these local positions, I think that money can only go to PACE. We can't take that money and put it towards anything else. Is that correct?
That's been my understanding.
PACE received a dividend.
Can you come on up?
Thank you.
Yes. Thank you for letting me speak. But PACE is governed by 42 CFR 460. Those are your regulations, and they're under the Federal Registry. To my knowledge, there hasn't been any changes. We get updates as we get changes for Medicare and Medicaid, just to answer that question. To my knowledge, I don't think it is illegal for Cherokee Health Partners, LLC, to spend money except for PACE. We received 3 dividends from Cherokee Health Partners, one in 2007, one in 2008, and one in 2009. When their articles of incorporation state that if there is enough cash flow, that PACE would receive a dividend from Cherokee Health Partners. But it's usually, they check their cash flow, and it's usually a 90-day cash flow at the end of the year. And those are coming from audited financials when they finish their audit. They are a separate entity. They are the incorporated entity. PACE is Cherokee Nation Comprehensive Care Agency doing business as Cherokee Elder Care PACE. So we are actually Cherokee Nation Comprehensive Care Agency. We're just doing business as Cherokee Elder Care PACE.
So on the dividends from those for-profit entities, I think
That would be
there's
one for-profit.
There's one or two.
One.
I was thinking there was two. Like,
Cherokee Health Partners is under the umbrella of Cherokee Nation Comprehensive Care Agency. It is the for-profit branch.
okay.
The non-for-profit branch is PACE, for Cherokee Elder Care.
So, are we all in agreement? Just to check.
Health Partners
Is an
is
LLC.
owned,
By
backed by comprehensive
51% is owned by
and
Comprehensive
by
Care and 49% by Tahlequah City. Cherokee Nation has
Connie,
the
today.
most percentage. So they
We need
rule,
time to go
you
over
know,
it.
the board and so
Okay.
on. That percentage.
I think I've heard you correctly, but I think this goes back to the need for the flow chart.
Exactly,
sheet.
and I almost did one, and I apologize that I didn't, because, and we will get that for you.
Okay, very good. And if you'll email me, that way I have time to review before the next meeting, that would be helpful.
Yes,
How
ma'am.
long do we have?
So what I'm hearing is
I don't
the
know.
only reason
You want to
why
ask?
it would be improper to use the PACE money for anything but PACE would be a violation of our own incorporation bylaws. Bylaws, but not,
The LLC's money can be used for, the dividend comes from the dividend for Cherokee Elder Care comes from Cherokee Health Partners. And I don't know that there's anything, and I'll have to stand to the legal to know that if it's illegal for any of those dividends to go anyplace else except for PACE. That I don't know.
I would ask more questions around this before, if we haven't specifically looked, because this was brought to my attention and I'm concerned about it.
Okay.
Because I don't want to,
Right.
because there's future directions or immediate directions that we appear to be heading that might impact these entities or change something about the entities, and I don't want to inadvertently kill a program and staff.
Yes.
No.
Right, because we are in a three-way agreement. We're really not licensed, so to speak. It's a contractual agreement between Cherokee Nation Comprehensive Care Agency, PACE, Oklahoma Health Care Authority, and CMS, which is Centers for Medicare and Medicaid. A PACE facility has to have a three-way agreement between Medicare, whoever Medicare designates in the state to be their spokesperson to that facility, and the facility itself. So it's a three-way agreement, and we have a copy of that if you'd like to see it. It's about that big. So
Yeah, I'm not so much concerned. That's
Yeah.
why we pay you guys the big bucks,
Right.
right? So you can be the experts on these things. So,
and I understand that, and I appreciate that. But
Yep.
anyway.
so if I have a question, I'm assuming it's something I can get electronically if I need to look something up.
I don't know if the contract is electronic, but I can sure kill another tree and give you a copy. And I apologize
No,
for
I-
having to do that. But I can bring you a copy, and you can,
Maybe
that
use
I've
a
got.
scanner and PDF, put it in a PDF or something.
I know. Take a while, but we can do that. Sure.
Okay, all right.
If you need it.
Well, we don't need it right now, so that I know of. I know.
And PACE is also regulated by 42 CFR 423, which is Part D regulations. Our folks get Part D because they get Medicare payments. We get a capitated rate from Medicaid, and we get a capitated rate from Medicare for each participant. And so those are regulated by Oklahoma Health Care Authority and by Medicaid.
Yeah, all the feedback I get is wonderful about PACE because it's beyond an adult daycare facility. It's a comprehensive care
Yes, ma'am.
facility, and it has really improved the quality of life.
Actually, it looks to be, we consider ourselves like an HMO. What we can't do on site within our clinics and our restorative folks, our PT, OT, we have probably 90 contracts with specialty folks and hospitals that reach all the way to Elk City, Oklahoma, just to make sure that our participants have a choice of who they want to see, like a urologist or a pulmonologist or whatever. What we don't have on site with our medical staff, we have contracts with folks and we provide their care. And we pay for all that from those capitated rates. And that's how PACE works.
Delma, thank you so much. I have additional questions, but not on this issue, just in general about the report. May I ask those questions now, or do you want to continue on this discussion and come back to me?
I think we've got a couple of other counselors, and we'll come back to you.
Okay,
and
thank you.
I do appreciate all your comments. You had some really good questions, and some that I would like to have answers to, especially the flow chart. So I, like you, I've got a lot of questions about home health. But let's go ahead and let Counselor Lay and Counselor Byrd ask their question.
Thank you, Madam Chair. Yeah, the flow chart, if you get that, that's a good idea. Send it to the entire council
Sure.
and probably to the AG's office. Because
Absolutely.
I'm going to ask them some questions.
Okay.
This stuff about who owns what, it looks like the comprehensive care agency was started in 2004. Is that correct? And somebody also started Cherokee Health Partners in 2004.
Yes, one was in February and the other was in September.
And is that the portion that Telephone City owns half and we own half, or what?
Southpaw City owns 49%, Cherokee Nation owns 51%.
And when did Telephone City buy part of that out from us?
It was a partnership from the very beginning.
I know.
In September.
Has Telephone City purchased parts or some of this since then?
No, sir. They still hold 49%.
And the board is split equally?
We have 51%, and then the board.
The board is split equally.
And I don't sit on
Yes.
that board, so
So the board's 50-50.
I don't sit on the health partners board.
Yeah, I think there are two representatives from each. We have two, and
Board's
Southpaw
50-50.
City has two.
That's my
And we have
question.
two alternates.
So when you control the board 50-50, then it sounds like a 50-50 partnership. That's where I'm getting at. And so which is the moneymaker? It's the
Cherokee Health Partners.
health partners. That's the for-profit. And when they get profits, then what do they do with it?
After their audit is complete, they maintain 90 days of cash, and then if there is money left, then there is a dividend that is proposed, and that dividend is set out, and it is split that way. If there's a dividend, it'll go 49% to Tahlequah City and 51% to Comprehensive Care Agency.
In the past few years, there have been dividends.
3 years there has been dividends. 7, 8, and 9. Yes, 7, 8, and 9 there was
So
dividends.
10 and 11 and 12, there's no dividend.
We have not.
Yet to be determined, waiting for audited financial statements.
Right. 12 has not been audited.
10 and 11 was no dividend.
No,
We don't know about 12.
right, not yet. Because they did maintain their 90 days of cash for 10 and 11.
And then, so, yeah, we need to know about this Cherokee Health Partners. And I'm looking at also some of this, it seems to me that, let's see if I can. The registered agent is Brian Woodland. Who is that?
He's the CEO of Tahlequah City.
So Tahlequah City holds the registered agent?
Which document are you looking at, Mr. Ryan?
It's on the second or third page of Cherokee Health Partners. All the correspondence was sent to Brian Woodland from the employer ID number, registered agent, status, and so on and so forth.
All right, Madam Chair,
Yes.
a registered service agent is just a designated person to receive notices and services. Sometimes it's your lawyer, sometimes it's the chairman of the board. It doesn't mean that they have any special privileges or anything. It's just, if you get sued, you're the person that receives it. Or if you get a notice of some kind, like Medicare, whatever, it's just a registered service agent. It's not really
I
a.
understand that. I'm just asking if that's the person who was agreed to by the whole group to be that registered agent.
Thank you.
I was not on that board, but I would assume that it was due to the fact that Tahlequah City was doing the accounting for that entity, and it is housed in that facility.
So Tahlequah City is They do the books,
They keep the books, and then they're audited.
so we own 51%, they do the books.
Yes.
Okay. And under this, I've got another question about Rhino, and is this Rhino is at the Salasol
That's it.
building? So we own the land, did we ever decide that for sure?
We own the land, we lease the land, and that's the only agreement that we have in that arrangement.
California City built this building
Yes.
to do dialysis.
Yes.
How long ago did they build that one?
They finished it a little over a year ago.
Okay. So the beginning date here says something like 11/1/2010. That must have been a lease agreement probably.
Yes.
And so there is an agreement, and I think there's an out for that agreement to purchase that building if we wanted to.
I'm waiting for an opinion from the AG's office on that.
Well, I've asked for one too and haven't received it. But let's see, is that lease agreement in?
I believe it is.
It seems to me there's a section that's an out for us if we wanted to purchase that building.
Yes, there is a copy of the lease.
And what page is that?
I think it's the last attachment, the last tab.
And how would you feel about doing that? How would the health department feel about doing that?
Well, I wouldn't be excited about doing it today just because it'd be taking on another thing in the middle of our mass capital expansion project. But if it's the desire of the council and the chief, of course, we would comply.
So what was the original agreement? California City was going to build the building, they'd make all the money?
I don't know what that agreement
Does
was.
anybody know that answer? Nobody knows that answer?
Counselor Lay, we are kind of jumping around here a little bit, but you're bringing up some very good questions that I am quite interested in, although it might be a little bit out of order, but
I'd be proud to yield it.
no. I have asked several questions about this because it should have already been opened, but due to the fact that we had the mold and they needed the space, and Tahlequah City allowed us to move our administration, and you were down there when we toured it, you know. So now, the way I understand it, we have some available space for them to vacate the building, and I'm anxious for them to do that, and because otherwise I do think it would have already been open. But we have so many constituents down there that is in dire need of these services. But things don't always work out the way we plan for them to. And if we didn't have the building being used for administration, I think we would have had it open. But I still don't know if they've got the deal worked out with DaVita. I would like to know that if they are ready to go forward.
I'll try to find that out for you today.
Because the way I understand it, even when they vacate the building and we've got to have at least one patient that's either a private pay patient or a pro bono patient, and keep it running for, I understood 6 months, but someone said 6 weeks to 6 months before Medicare and Medicaid will start to pay us, to reimburse us. So, but I would like to know if it makes any profit, who's going to get it. So I assume the way it was explained to me, Tahlequah City.
My understanding is there is no agreement for anything outside.
We need something to understand as to, Some people says it won't make money, and then I've talked to people from the Fort Smith Dialysis Center who say it's a cash cow that you can make a lot of money once you get it up and going. So I don't know if they more or less subcontract it out and negotiate with DaVita to do it, because then would DaVita be making the money and give them something?
That would be question that Tahlequah City would have to answer.
Well, I don't know,
because
so-
I don't know what their relationship
Other than the
is.
service to the people, we would not be making any money from it the way it stands now.
Oh, man.
But we would be accomplishing our goal by providing services.
Yes.
Well, we're more than anxious to get it open, so. And also, we're having our big community meeting down there on the 27th at Blue Ribbon Downs, and we would like to be able to make some kind of announcement as to when it is actually going to open, but that may be impossible. So, Councilor Bird's wanting to speak next.
Was this not, this partnership, was it not blessed by the council? I heard Councilman Watt ask some questions about this very organization. Does this not come through the council? For
The
blessing?
Cherokee Health Partners?
Yes.
It's my understanding that it did, yes.
Yeah.
It was, yes, it was by resolution. And I think a copy of that is in the file.
Okay. So we should be aware of all of this then, so.
I think there's just been a.
I mean, I'm reading this book here. I mean, I just saw
Council
this.
updated, you know, like a routine report so that it wasn't a surprise to everybody to hear about it and then have all the questions, you know.
I think once we get a better idea of the flow chart, I'm trying to read this as the reports are given. I see Brian Woodruff on here, and I see Melissa Gower's name on that, so that's how it was originated. But I'm also interested in that 5149. Once you see that, very seldom do you have a board of directors where there are even number board members. I haven't heard of one.
You're right.
So there's got to be an odd number then. We would hope if we're the 51% owner, we have the 3-2 or, 4-3 board. We always need to have an edge that we're the 51%.
I think that may have been lined out in the operational agreement. Brian's helped
Yeah.
review that as well.
Okay.
We meet monthly as a board, and as a matter of fact, tomorrow is our monthly meeting for the Cherokee Health Partners.
Okay.
So we can certainly discuss this tomorrow.
Okay. Thank you, Madam
Okay.
Chair.
Eh,
Many more questions, but I have to read my homework first.
Okay. Well, I think we all do need time to examine this and have more questions next month, but
And if you could email those to me as you have the time to review that, maybe I can have the answers prepared for you in advance.
I am particularly interested in the home health part of it. I see they do have a flow chart here, but I would like it broken down into the different county areas, how many home health workers we have actually out in the field, because that is something that my constituents talk to me about all the time. And they have home health that comes to see them, and they're very in a hurry, and they tell them we take care of the babies at risk and go out and make home visits and do all kinds of things that we're just very short-handed.
That's probably the public health nurses making those visits. That'd be separate from home health. They basically do the same thing, except they're
Well,
not.
they just say they're from the home health, and I know who the public health nurse is, but it could be, I don't know. But I'm just wanting to find out more about it. So could you give us a report that shows how many home health workers that go out? I mean, I don't know if it's just the public health nurse that goes out and changes bandages and helps out with people who've had colostomies and things like that. I don't know if that's the public health nurse that's doing it or if it's actually someone from home health. But when people call me, they just say it's their home health nurse, and it could be the public health nurse.
Yes, you're absolutely right.
The home health, just a little bit of history, the home health was incorporated back in 1994. And there are 3 branches to the home health. There is the home health, there's the Advantage side, and there's the hospice. So there's 3 areas within that home health. Right now, Ms. Casey Foster is the interim director of home health, and I'm sure that she can give us a breakdown of the counties that they serve and the nurses that she has in those areas. But I think there probably is some confusion between home health and the public health, because for home health, it has to be something that the doctor has ordered And it's Medicare, Medicaid, or private insurance paid. So all of that has to go through those steps to get approved for the home health, to go out and do the visits and all of that. And then the doctor's orders stipulates the visit and the orders of what they're supposed to do at that visit and everything.
Okay, answer this question for me about the Advantage program. Is that something from the state of Oklahoma that is for the lower income people that helps pay for medicine and things like that? So that's one branch of it also.
Right, we do that side of it. We also do the case management side of that on the Advantage program. But we do get our payer source from that is the state. So, and then you have the hospice side. So there's three areas in that. And that is completely separate from Cherokee Comprehensive Care Agency, Cherokee Elder Care,
Right.
Health Partners. It's a completely separate.
I understand that.
corporation. Yeah.
But then there's three divisions, you
There's
say
three
there.
divisions
Okay.
within that.
So with hospice, does our hospice coincide with rules and regulations?
Medicare, yes, ma'am.
Okay, so like most people, they won't pay for more than, there's a time limit.
Yes.
And a lot of times I think they're very anxious to put people on hospice that makes a lot of money, and then they're still living and they get a call and say, oh, they kicked me off.
Well, actually, I will say that our hospice has been just the opposite. For the last year or two, we have been getting them so close to the end that it has made in fact, some of them has been anywhere from 1 day, 2 days, up to 2
I understand.
weeks. So over the last year or two, our stays have become shorter with our hospice for whatever reason.
But I do have an aunt receiving hospice services through Cherokee Nation, and she's been on service for at least 6 months. Thank God.
Well, it's a good program, but all this is very complicated, and
Yes.
we're just trying to get a better understanding of it. And I appreciate all the council members' interest and questions, and we're just trying to get a clearer picture of what is going on and who's making the money and are we benefiting from it. I think that's one of the big questions that Councilor Kara Cowan Watts has asked, which is a very good question. So, yes, Councilor
Is it my
Watts.
turn again?
Yes.
Okay.
Oh, I'm sorry, I left out Councilor Keener.
Yeah, thank you, Madam Chair. Would you remind me on the 122 patients at capacity, is that the elder care?
Yes.
Okay. Now, are we thinking ahead on that as far as what we're going to do, the next step? But I didn't see that in the resolution we passed last month. So.
Well, I think the anticipation is to expand that service to another community close to us.
Right. Originally, the way it was set up was that the first one would be in Tahlequah, and then we had 3 other sites, I believe, which was Muskogee, Stillwell, and was the 3 other sites. Originally, I think we were planning on going to Stillwell as our second site, but as we looked at it to see what the participants in the different areas, how many there were, and different things like that, the board had just about decided that Muskogee was going to be the next best step to go to. We had just started looking into that about a year ago, is that correct? And put a plan together to start looking for land and place to go to in Muskogee to open the second site in Muskogee.
So that'll be developing?
That should be developing as it continues over the next year.
Okay.
Well, just so we're all clear, our elder care and PACE,
It's the same thing.
same thing.
Yes.
So are all of our patients in elder care Cherokees, are they
No, it's
non-Cherokee, open to everybody?
It's open to everyone. It's Medicare based, so it has to be open to any Medicare.
Well, is it making any money? That's my question.
It's a very profitable business.
We have $750,000 in savings and around $300,000 in our operating campaign.
And that's what we're looking at to be able to go ahead and develop. We have to be able to have those funds,
Well, I
to
know,
move on.
yeah, I know the original plan was to build the next one at Stillwell, but you've done some kind of
We've
study
done
or
research,
analysis.
and
And
it looks like Muskogee's probably going to be, and that may change. I'm not on the board any longer, but from what I saw last was Muskogee looks like the best place to move.
We had a feasibility study done for Stillwell 2 years ago by Sharpless, an outside entity, and it showed that there would probably be around I can't remember exactly, around 200 dual eligibles, and that best fits the PACE model. Dual eligibles being their financial and income justifies them to receive Medicare and Medicaid, both. Muskogee, I just looked, Muskogee County alone has 546 dual eligibles that could be picked up by a PACE program. They're ready for, so if you look at the numbers, it would be better to move toward Muskogee, and the board has talked about just trying to find a building to renovate in Muskogee. We have to go through another application process to add zip codes. That's what drives a PACE model, is zip codes. And we want to pick up zip codes in the Stillwell area and bus those folks in, and then look at finding a building in Muskogee to renovate. Now, that's just all supposition if that's possible, but that's kind of what they're talking about, Madam Chair.
Well, I'd like to comment on that because I think the big question for the council is going to be which one of those places would serve more Cherokee citizens, and I think I already know the answer to that. If we're putting out big money here to help people, sure, we want to help everybody, but I think you would have a high percentage of Cherokees at Stillwell and not over at Muskogee. I can be wrong, but I'm just telling you from the viewpoint of helping our people. That's the way I personally feel about it. But
well, and actually, the feasibility study that we had done after the first feasibility study, the one that just targeted Stillwell, also pulled in Salisaw and some other areas. And PACE facilities are driven that they don't want the participants riding more than 45 minutes because of, their diagnoses and things like that. So that all has to go into play also when you decide where you're going to set.
So you're speaking of people who come for daycare.
Yes, ma'am.
Okay.
Yes. The way the PACE model is set, they have a plan of care, and they can either be in the facility 1 or 5 days. It would vary, depending on the plan of care. So, yes, ma'am.
Well, I think we're on the right track here. We've gotten a lot of answers to our questions, and we'll probably have a lot more questions next month. But does anyone else have some? Okay, Councilor Keener. Go ahead and finish. Then Councilor Watts.
It leads me to my next question, and there have been a lot of good questions here on laying this out for us in a format that we can all understand. I'd additionally like to ask you to put the financial picture in here. I noticed there's some of the notes on the same page of the report, but maybe we could break that down to each group and how they interrelate as far as the financial picture, if that could be possible.
And as far as future reporting purposes for this board or the council, I'm kind of gathering that you'd like to know maybe the number of patients that we're seeing, and of those, how many are Cherokee, and then the financials of that service for that month. Is there anything else that you would like for me to include as we break down? Okay.
Maybe one other thing would be to add what the future what you may be looking at in the future.
Okay.
I have another question.
Thank you, Madam Chairman, for...
Yes. I didn't mean to interrupt you, Councilor Keener. Councilor Thornton's asking me. So, is this by county? Can you give it to us by county? Because I'm assuming all the people that attend PACE now are from Cherokee County. Are some of them from Adair or that ride?
I don't believe.
Some of them are from Muskogee. Some of them are. I can give you a breakdown. I can bring to the council a map of zip codes to show you where those folks are coming from.
But we'd really like to see the question answered as to how many Cherokees are being served and how many.
It's around 60-40 right now. But I can give you an exact amount.
Well, I don't mean to be argumentative about your feasibility study, but I'm just saying that from me guesstimating, I just think that the one at Stillwell may not have enough figures to bring in that much money compared with 200 compared to 500, but
well, and the thing about Stillwell, Madam Chair, is we can bus those folks. They're not going to miss they're going to be taken care of. So, and that's the good thing about PACE is we've got transportation. We've got 9 vehicles right now, and we also usually do a grant with the state, and we'll pay 20% down or 20% of a couple of vehicles, and they will actually give us vehicles because we serve the elderly. So
No, because it's
a
too
program.
far.
So we can bus, those folks in, and that's why we're expanding, doing another application to expand our zip codes into Stillwell, so we can pick up those folks and make sure they're served.
Councilor Watts, would you next?
Thank you. So just to make sure my mind's clear, first of all, I just want to say thank you again to everybody involved for compiling the information.
Okay.
I know this spans over a number of councils, a number of administrations now. We've got a lot of new staff and leadership. And it's just time to reassess the situation. And at the end of the day, somebody brought something to my attention outside of meetings that I didn't understand after we had passed things at different times. So we'll get the cheat sheet with the org chart and the different terms that match. Every like an entity may be named one term, one way or 5 different ways it sounds like, and how they're layered. And then I think the big question about just making sure if we understand if we dissolve one of those, the for-profit that's supposed to benefit PACE, what does that mean? Is there any triggers? And what if we try to use that money from those entities for anything other than PACE? And it's supposed to self-fund itself and fund the next entity. So my other questions that I had on your report is George Valier has handed out what is happening inside the Claremore Indian Hospital for the 11 or 14 counties that are served by their outpatient and contract health services. And this is going to be pretty complicated for our citizens that don't understand how all this works. It looks like they're asking then that they would have to come leave the facility where they expected to have care, like, for example, the new Benita Clinic, and then establish a patient chart before we'll look at contract health service payment.
Well, Councilman, if I may.
Well, so here's what I need, and this may have to be, I'd like it before the next meeting so I have a chance to review like a week or two before. But I need to understand where this is at, how we're going to do it, because I think the new Benita Clinic, Salina, all our new facilities, their Cherokee Nation entities are very attractive when we are being served by Indian Health Service and have no money to update our facility. It's overcrowded. I mean, IHS is what it is at Claremore. So there, it shows that in his report that all these charts are down, all the services are down. That could be because we have a mass exit of Cherokees going over to these new facilities because they're real attractive until they have a situation where they have to be served. So I would like a report on how the facilities are impacting. Like, what does that look like? Where are the Claremore Indian Hospital patients? Are they only being served, and how many do we not have charts, and what will that impact Indian Hospital? And can we fix this contract health service? Because otherwise they're not getting that 5% dividend. We can crow about it all day long, but if they are not delivering on that, then we're failing our people.
Yes, I agree.
Okay.
I agree.
So can we have that maybe in week or two?
I will try really hard.
Okay, very good. Thank you, Madam Chair.
Councilor Thornton is next.
Yes, one of my questions would be, as far as Rogers County and Tulsa County, that area is concerned, why haven't we ever built a clinic in that area that would help our people? They wouldn't have to run in to try to get in here or get into Claremore Hospital, where we would have a geographical location where all those people in that area could be served out of a clinic.
Are you talking about a regular health clinic or
Yes.
a PACE clinic?
Mm-hmm.
Well, I think we're building one in Bartlesville.
Well, that's up north from that area.
I don't know. I
No.
guess because, no one's brought it forward and we're...
It looks like maybe an ideal location to put some type of clinic up there to help our people, since we have so
Yeah.
many people.
That Brian has mentioned there is it's an IHS facility, isn't it? Yes?
It's
Contracted from IHS and a resource clinic there.
Tulsa County also has a lot of Cherokees. But anyway, that's one question. I'd like someone to look into that, to see what it takes to build a community. Another thing is, I'd also, on this pace and this business we're talking about now, has anybody looked into maybe building a building geographically located, not in a city, but in an area where it would serve all four of these counties right here?
I'll have to defer to the experts on, I don't know that you can do that.
I'm sorry.
Well, I mean, because of licensures, there's rules on how you serve the zip codes, if you will. Building a central,
I'm sorry. By contract, the federal CMS or Medicare, Open Health Care Authority, and we as the Cherokee Nation Comprehensive Care have to enter into a contract. And you can pick all the zip codes you want, but it has to be approved by Medicare and by Oklahoma Health Care Authority. So, you know, that's just the way they designate. So we can go into...
That don't stop you then.
I'm sorry?
That doesn't stop you from building a geographically located
No, you can...
clinic or service or everywhere it is.
You're talking like out in the middle of the country where
Yeah.
there's no town.
Yeah.
No, I
oh, I
don't...
misunderstood the
Okay,
question.
no, that wouldn't, as long as, wouldn't really even have to, it would have, if you were going to serve those folks.
You could serve
under
more
that-
Cherokees that way.
Under that contract, you could serve those folks, but it would have to be within a zip code area that was designated by that contract. Okay?
Okay, but you could still build it in that zip code area and still serve those other zip
Sure.
code areas.
I misunderstood the question. I
Oh.
apologize.
Yes, sir.
I mean, if you're going to put something over at Muskogee, are you going to keep it in the Cherokee Nation? Or you're going to put it outside the Cherokee Nation?
I would probably be within the Cherokee Nation, but we
Okay,
could,
then
we
you're
could pull
going to
zip
serve.
codes from
You're going to
someplace
serve
else.
zip code from outside. You're talking about busing in from outside.
Right.
It would be a whole lot easier to bus people if you had to bus them into a location. It'd be a lot less miles to be traveled by those people.
Yes, sir.
So,
And the-
really need to know how many people receive this health care from these four counties,
Well, there's 120 right now.
from all four counties.
Within those zip code areas, and part of the zip codes only go into part of the counties. You know, it's driven by the zip codes. So, and I can get you a map and show you which, you know, where the zip
Because
codes
I know
is.
we've got a lot of people in Sequoia County, and we've got a lot of people
Yes, sir.
with health care in Cherokee County, and a lot in Adair. and-
Yes, sir.
and I would imagine there's more in there than there are in Muskogee County. But as far as our people,
Right, exactly.
and
Yes, sir.
that's primarily what I'm here for, is to try to keep this within the nation where it will serve more Cherokees.
Right, and, you know, but also we have to make sure that we stay within the guidelines of CMS, because it is a federal program.
Show me a guideline where you can't do that.
Oh, there's not any, but I'm just saying it's
And
open to
then we're
everyone.
staying inside guidelines.
Yes, sir.
Thank you.
Do we have any other questions today? Yes.
Thank you, Madam Chair. I'll just go ahead and ask just to make sure it's on the next report, that on the shared salaries, how many of those we have, one or more?
Shared salaries.
Yeah.
I guess I'm not sure. Are you talking about on the physician?
Yes.
Okay. That's the only provider we have at this time. Now, we'd like to enter into agreement with a couple more providers, but we thought we should understand, let the council make sure they're okay with an arrangement such as that before we proceed.
And is that 5149 as well?
Now, it's just splitting the expenses, and then it functions as a contract health referral. We refer to that provider. And I do have a breakdown of the return on investment with that particular physician that I could share with you guys if you'd like to see. It's been a very successful arrangement for us. It provides a lot of services.
Maybe on the report too, there's other shared items. I don't know if there is, but if there is, we could.
No, I tried to get
Not
everything
just
that I'm aware
salaries,
of.
but Equipment or anything like that. Thank you, Madam Chair.
Yes. Councilor Thornton?
Yes, she was talking about the board members. You have 4 board members.
On Cherokee Health Partners.
Cherokee Health Partners. Okay, on that board, is one of them a chairman?
Yes, it
Does he
rotates.
get to vote?
Yes.
Okay. And from what I've read in here, and I may be wrong, it says you have from 3 to 5
Board members?
members.
Okay.
I may be wrong.
Well, we can ask tomorrow.
But
I'll
that's
take a
what
look
it
at that.
says in here from what I read. And, you know, this is going to be great for us going through it because it's going to give us some idea of questions to ask the next time.
I look forward to it.
You know, we're here to help, and we're here to help our people just like
That's
you are.
right. That's right.
That's the other main.
And I will say
That's
that
what I'm here
that
for.
particular service provides a lot. It's a good service to our patients because the nuclear stress tests are primarily what that entity provides. And those patients normally would be referred to Tulsa or Fort Smith and drive, 70, 90 miles for a procedure that takes less than 2 hours. So something we could look at other communities doing as well.
Like where I live in the lower part of Sequoia County, it's like 45 minutes or less to get to Stillwell. It's probably a little closer to get to Muskogee. But there should be some geographical location within these 4 areas that we can set up and build a clinic or build a building to support this healthcare system. I'm not for shoving it over on one end of one place and one end of the other. I'm just not for it, and I don't know if anybody else is. But that's where I'm at. Thank you.
I understand.
Well, I have a couple of questions. And next month, I'd like for you to give us some kind of little short synopsis here on how we're doing on recruiting, since several of us went up and toured the Veneta Health Clinic, and I understand that we're going to have to hire 100 and something people up there, and we've got shortages throughout the system. What is our plan, our procedures forward in getting some people to fill those vacancies? And I was also wondering in particular if we ever got the doctor replaced at Hastings that does the hearing aids and audiology.
As a matter of fact, I think we are hiring 2 audiologists. Is that correct, Ron?
We have one hired, and we're trying to find funding to get a second one. That one is it's just making its way through human resources right now.
Okay. That'll be a while. Okay, the next question I have is this. I guess about 3 years ago, one of the big issues down in our southern part was for people were wanting to go over to Fort Smith for tests and referrals, and at one time Redbird Smith Clinic was sending a lot of people over there because we got a contract to do those things with Sparks Healthcare System. But it's my understanding now, very, very few people can get a referral. I guess if they directly request it, they might let them have one, but we are referring everybody up to Tahlequah when they may live in Roland and it's 4 miles over to Fort Smith. And like where I live, it's 19 miles to go to Sparks. And it's just a lot more convenient. And I didn't know if there had been a directive from higher up sent down to them to start referring everything up here to Healthcare Partners so it would make us a little bit more money. But it's mighty inconvenient for our people. And some of them, of course, got confused when you mentioned that we had a contract health thing going with Sparks. They thought they could just go over there and check in, which it wasn't meant for that at all. But I wish you'd check on that for us because we have last time I checked, we had 35,000 active charts at Redbird, and that was last week when I checked. And they did have more than that, but I guess they sent a lot of them off into the archives or something up here at Tahlequah. I don't really know. But I know that we've got a lot of people that are not able to go to Tulsa for their health care. And that's where they seem to refer many, many people. And that's a 110-mile drive versus 20 miles. And I wish you'd check on that for us.
Ideally, we'd have an entity like that in all of our communities, the Claremore area, your area. So, because we want to be a service to the patients, and nobody wants to drive that long for a test or for anything for that matter.
Well, at one time, we were meeting regularly with Sequoia Memorial Hospital in Sallisaw with the administration of Redbird Smith, and we were sending a lot of the sleep studies over there, plus different types of scans, but I think we've pretty well quit that also. And the administrator out at Sequoia Memorial was wanting to set up a meeting again, and I don't know that anything ever became of it, but it's much better to do a sleep study there at Sequoia Memorial Hospital than coming over here. Because I know.
Oh, yeah, I think we're, 18 months behind on sleep studies at the hospital in our program. So I'd be happy to visit with them about a partnership of that nature.
Well, I think we have one, but I don't think we've been utilizing it.
Okay. Well, I wasn't aware, but we'll look into that.
We do have a preferred contract with Sequoia Memorial Hospital that they will accept the Medicare rate.
Right.
We do have that established. And they're pretty helpful about emergencies coming in. They will call Hastings and try to get things, transferred out, things like that. They're really helpful, but I don't think we've been utilizing them that much for scopes and different things that they could do. So I wish we would, because gas is so expensive, and it's just serving our people better to let them go closer to home.
I agree.
And next month also, I'm hoping that you'll have this home health broken down into a clearer picture for people like me that are hard to understand. I want to know who's going out to make these visits. Are they public health nurses? Are they home health workers?
I would say there are both.
Okay. Any other questions? Okay, we need to go on to. Oh, you do? Okay.
Just wanted to do a
Okay.
short one.
Okay.
The Three Rivers Dental Clinic is, apparently when we do a crown, we're charging $200 for it. Anybody had any phone calls about that?
Oh, Dr. Jones is very educated on that topic. I'll ask him to come up and speak to that if he doesn't mind.
They have a crown program at Three Rivers, and they're going to open it up at Veneta. But that was set in motion before this administration came on. And the way it's set up is the $200 covers the cost of the materials to fabricate the crown. That's how that was set up. I'm still doing a feasibility study. I'm trying to get to the bottom of how it was all set up, how we take money, things like that. But there's a lot of other issues that have come up that have kind of distracted me, and it's been on the back burner, but it's back on the front again. So I sent out a reply to you on your question and to Counselor Hoskins about the question that you had.
Is it a written policy?
It is.
Okay.
I sent a copy of that to Counselor Hoskins. I can send it out to everybody.
Yeah, I think you should. And also, why doesn't the 5% contract referral fee or the other referral fee that's supposed to take care of these denture things and dentists and dental work, why can't that pay that $200?
The PROS program, it's not included in the PROS program. That's what you're talking about with the dentures and the partials. It's not included in that program. As far as the 5%, that would be a question for probably the AG's office. I don't know where that 5% money is allocated to go. So I've asked that question. I haven't got a clear answer on that yet.
I think we can look at that.
There's two line items in your budget for dental that I know, and I'm aware, there may be more. And it seems to me we could say, we're talking about elders here who can't afford hardly to drive there to start with. We can't pick up $200 for them.
I think that's where we'd have to set up a firm policy on that. I think if we just open it up to everybody, we're going to open up a large can of worms that we're going to have to, then we're going to be dealing with everyone wanting to come in and get that service for free.
Far be it from us to serve our people. I mean, that's what this is for. We're serving our people.
I agree.
No.
I agree. And our question is, how can we make it feasibility, the feasibility part of it, so it doesn't break the program?
I'm not on it.
Because if you're talking about, you go out in private practice, you're talking about $1,100 to $1,200 for a crown to get done. If you start looking at how many crowns are placed on the population, how much are we willing to spend on
I
that?
understand that. We're talking about $300 or $400 for a pair of glasses out in private practice, but we're paying that.
Right. And we've got some machines set up in place. Like I said, we're doing a
We've got
feasibility.
$12 or $13 million in the 5% contract health fund. 12 or $13 million. Thank you.
I see your point clearly because we aren't spending it. So,
You got me.
Dr. Jones, next month, could you give us a little report on how many dentists we have at each clinic, how many dental chairs, and how many shortages we have, and maybe what the procedure is to get an appointment? I'd appreciate that very much. And this brings another thought to my mind. I would like to have that same kind of report for optometry because it's always a jigsaw puzzle. One person goes down there and they get their glasses free. The next person goes and it's $200. And I don't understand it. I never had. My example are my children. They're both grown, and one went down there, her glasses were free. The next one goes down there and his glasses are $200. It makes no rhyme or reason to me, and I would like it to be explained in writing. What is the difference? And I think Councilor Hargis has had a good question for a long time about people who have insurance, who are, theirs is up here, and those who don't, it's down here. So is it just a gimmick? So
let me understand, you want to know how many dentists we have, how many chairs at each clinic, and how many vacancies we have.
Right.
Problem.
And also, we'd kind of like to know in our area who is the private dentist that the contract, or who has the contract to do the dentures in each area, because down our way we did have 3 different dentists doing it. Now I understand we've got 1, and our clients aren't very happy with him, and they only allows, like after you get your dentures, 1 visit to come back for adjustments. Well, that's not reasonable. I mean, I'm not a dentist, but I've got horse sense. And I know when you get a new set of dentures, you might need to go back as many times as you need to till they fit.
That contract floats. Dentists come on and off of it all the time. And the problem is our fees have got outdated. And that's why we don't have very many people on it. So right now we're collecting data to try to upgrade those fees and get a reasonable fee and see what we can pay in that. But yes, the amount of dentists that are on that contract are pretty short, and it's because the fees we pay are outdated. In most cases, it's below what Medicaid pays. So a lot of private dentists have taken themselves off, and we don't have a lot of people to choose from.
Well,
but we're in the process of fixing that. It just takes some time to get all that data together.
Well, Madam Speaker has brought this up in the past, and I agree with her. We need to look into it seriously of having a denturist place where we make our own dentures somewhere. I think we could find plenty of people that would be willing to work for us. That might be open up a whole nother can of worms, but I think it's something we need to look at because dentures are very, very expensive.
I agree.
Councilor Thornton?
And in the past, I know I've gotten a few letters on dentures, that the dentures that we receive is the cheapest material that they can get to make dentures with. And the thing that we need to look into also, that I think, if you want a little better dentures, just like you want a little better eyeglasses, what's it going to cost you?
Exactly, and we're doing that right now. We're looking at the feasibility. In most cases, an average set of dentures is going to cost you around $2,500 at a private practice. Our fee right now, we pay approximately $1,400. So, there's not very many dentists out there that are willing to cut their fee $1,100, and if they do, they're going to cut somewhere, and that's why we're getting low quality. Exactly. That's why we're getting low quality.
We're not getting very good quality.
Well, I appreciate you coming, Dr. Jones.
Thank you.
You're welcome. Well, as always, health has lots of questions, lots of concerns, but it's a big service to our people that everyone really appreciates it. And I'm hoping the health department shows up at our community meeting, and I think our meeting might be coinciding with someone else's community meetings. And,
Oh, no.
but Curtis?
I've got a comment to make about the dental. I got a good friend with dentist, and he did work for the Cherokee Nation, and he didn't get paid sometime for 6, 8, 9, 10 months. And he said, I just can't live like that. You know, he needs, at least 30 days, they need to be paid. But his payments were way, way out. So that's something that you may check in on and see where the problem really lies,
We'll check in contract health. Okay.
Yeah. The problem in the past has been the way that things have been progressed through. I think that has been fixed somewhat. That was about a problem that they had before I came on, because when I was in private practice, we had that same issue. We worked with Brett Hayes to get a lot of that fixed. It had to do with the paperwork, and the paperwork being done exactly correct. If one little thing wasn't done right, it got kicked back. So it had to do with the paperwork. I think we've got most of those bugs worked out now. It's just a matter of getting the fees up where we can get more dentists onto the contract so we have more competitive atmosphere. So,
Thank you.
Any other questions today?
Good report.
All right, we thank you very much, and our next meeting date is at 1 o'clock on.
Madam Chair?
Yes.
Point of order. We have agenda items.
Oh, is there still? Oh, yes. I'm sorry. We do. Councilor Fishenhawk is not here, so I am assuming that
Move to table?
move to table to next month. And are you satisfied on?
I am. I don't know if anyone else
Okay.
items on the agenda had anything to do, but otherwise, from my perspective, this has already been dealt with.
Okay, thank you. You had some good points. We all want questions answered. Okay,
We need to vote for tabling.
oh, yes. All in favor of tabling Councilor Fishenhawks till next month?
Aye.
So it's tabled. Okay. The next meeting is scheduled for Monday, December the 10th at 1 p.m. And I'll entertain a motion for adjournment.
So moved.
All in favor of adjourning?
Aye.
Okay, this meeting is adjourned. Thank you everyone for coming, and